Overactive bladder is defined as a group of symptoms with or without frequent urinary incontinence in the absence of an infection or other obvious pathologies, often with complaints of frequent urination and urinary urgency, along with or without urge incontinence. The aim of this study is to assess the validity and reliability of Turkish Overactive Bladder-V3 and to evaluate the results of behavioral and physical therapy such as prompted voiding and timed voiding, bladder training, and pelvic floor muscle training with OAB-V3. The study was carried out with 90 patients who applied to outpatient clinic between October 2020 and April 2021. OAB-V3 Turkish validation was developed from the English version. Demographic data of the patients were recorded. Patients referred to functional urology clinic with OAB symptoms were included in the study. For the patients to be included in the study, they were required to read and write in Turkish to understand what they read to be over 18 years of age. Patients who were under 18 years of age received active OAB treatment, cannot read and write Turkish, cannot understand what they read, and did not agree to participate in the study were excluded. The demographic characteristics of the patients were recorded and their physical examinations were performed. Patients filled in the OAB-V3 Turkish form consisting of 3 questions: Overactive Bladder Questionnaire Form V8 and International Consultation on Incontinence Questionnaire Short Form. 3-day urinary diaries of the patients were recorded. The patients fill out the same forms again after 2 weeks. The group receiving behavioral therapy within these patients filled out the OAB-V3 Turkish again after 8 weeks. A total of 60 OAB patients and 30 healthy control, including 30 OAB wet and 30 OAB dry, were included in the study. The mean age of the patients was 56 and the mean BMI was 35 and the mean duration of OAB complaints was 54 months. The mean score of the OAB-V3 was 7.99 and OAB-V8 was 19.78 and mean score of the ICIQ-SF was 12.90 scores. The mean OAB-V3 score of the control group was 1.56 and the mean OAB-V3 score of the dry OAB patients was 2.98 and the mean OAB-V3 score of the wet OAB patients was 3.78. The results of the reliability assessment showed that the intraclass correlation coefficients of the total OAB-V3 score was 0.82 and the Cronbach alpha was 0.81. Test-retest reliability was 0.68. In the validity analysis, the OAB-V3 total score was highly correlated with that belonging to other questionnaire forms. The mean total OAB-V3 scores of the 30 patients receiving behavioral therapy decreased from 7.89 to 5.86. The same decrease was observed in the OAB-V8 and ICIQ-SF scores. This improvement in symptom scores was also observed in bladder diary values. The OAB-V3 Turkish version has been developed and approved as a reliable tool for evaluating patients with OAB. This study showed that behavioral therapy is one of the effective treatment modalities in the treatment of OAB. Urinary frequency, urge incontinence, and for improving OAB-V3, OAB-V8, and ICIQ-SF scores. This simple questionnaire is expected to be useful in clinical studies and medical applications among Turkish-speaking OAB patients. Thank you.